Typically, for patients who have suspicion that prostate cancer may have spread beyond the origin, there's a nuclear medicine technique called bone scanning that's been used to look at the skeleton, and CT has been used to look at lymph nodes and other organs to detect spread. The problem with these techniques is that they often give the wrong results because their accuracy is quite limited, and that can have very bad consequences for men because they get directed to the wrong treatment. The new technology is called PSMA PET CT scanning. So we use a radioactive molecule called DCFPYL that has a radioactive atom of fluorine incorporated into it when it's manufactured by Cyclotek. Because PSMA is expressed in high concentrations in prostate cancer cells, but in low concentrations in other normal cells of the body, we can detect sites of spread of cancer with very high sensitivity and specificity. So the accuracy means that men can get directed much better to the treatment they need. DCFPYL is one form of a PSMA molecule. By putting the radioactive fluorine into that molecule, we're able to use it for PET scan to detect the sites of prostate cancer throughout the men's body. PSMA PET has been really a game changer because of the greater accuracy. The extent of PSMA PET imaging is likely to be extended to helping to monitor the effectiveness of therapy. And also PSMA PET CT is an essential part of evaluation of men who get a form of treatment using PSMA. And that treatment using radioactive materials has already been shown to improve the outcome and survival and quality of life of men with very advanced stages of prostate cancer. We've been doing PET scanning with Cyclotek technology, supplying a number of facilities in Australia. We were able to recognize early on that it was going to be a very important technique for helping men with prostate cancer, but the main compound used for that FDG is not particularly useful in prostate cancer, and we were looking for something better. Professor Pompa at Johns Hopkins University told me that they had a new molecule, a better molecule, DCFPYL, that they were developing, and he suggested that we could have a license for that if we committed to sponsoring clinical trials in Australia and New Zealand to help them improve the evidence base supporting its use, and also to apply for registration or Medicare reimbursement. You can't access PSMA PET scanning unless you have a referral from a medical practitioner. And as long as a medical practitioner is satisfied that the information is useful, you can access a scan. We have traditionally viewed cancers as being a single disease. So prostate cancer is a single disease, breast cancer is a single disease. But we've learnt that in fact there are all sorts of different diseases that happen to occur, and that they have different courses and they need different treatments. So one of the marvels of PET scanning is that it lets us dissect out what the actual genetic and metabolic abnormalities are that are driving the patient's cancer. With that sort of insight, you can separate out patients, for instance, who have very aggressive form of prostate cancer who need much more aggressive treatment, and patients who have a more indolent form of disease where in fact sometimes treating the cancer might be worse than the cancer itself. So that's where we're headed, much better able to predict what will happen to each patient, much better directed therapies that will give them better quality of life, better survival with much less side effects, and hopefully saving the healthcare system money from avoiding things that cause more harm than good.